Good morning, everyone. So my name's Jake Wilson. I'm a urology registrar. 16 or so months off consultant at present, and I work in Cheltenham General Hospital, which is part of Gloucestershire Royal Hospitals Trust. Very greedily, I've been given the opportunity to present two projects. I'm going to mainly focus on one for the moment, so we don't overrun. So this is the first project, so the RALP using machine learning and natural language processing to predict the operative times of robotic assisted laparoscopic prostatectomy. I'd just like to acknowledge the help for two of the HSMA. Well, I guess we're going to be alumni soon, aren't they? Lee and Rich and Heath as well, who I know spoke earlier. So just a bit of context and background to this project. So you will often see in the news a number of people who are waiting operations procedures is quite significant, although it has started to come down within urology. There has almost been a doubling of number of individuals who need treatment or a clinic appointment or an operation since the pandemic. So the waiting list to be seen for everything across the board is going up. Here is a little graph of our trust's performance compared to the national performance for the 62-day cancer target for prostate cancer. So there has been a continuous really degradation of our ability to hit that target since COVID. And that's in line really with the national picture. The 60-day target is from referral to treatment for their prostate cancer. So that's a metric of which the trust is measured upon, and we're not doing very well at that. So there have been lots of reports which have been published on how to try and improve this. All of these very nice sounding reports, and they all touch upon very similar themes, which essentially is trying to improve theatre productivity. So trying to do more with the same amount or the more with less. And how do we do that? Well, we do that by increasing our productivity through data-driven change, digital tools, and artificial intelligence, which I'm hoping we are able to demonstrate with this project. So what did we actually do? Well, what we did is we got a list of all of the robotic assisted laparoscopic prostatectomies which have occurred over a 10-year period of time. And what we did was we went through electronic and paper notes, which was actually really very time-consuming thing to do. And we actually got around 350, but only 124 of those were complete, although we're continuing to work on that to try and get more and more data. So in terms of our outcome, we were looking at the operative time for a particular operation, the robotic assisted laparoscopic prostatectomy. And then we looked at a number of features, so surgeon, presence of a trainee, technical features such as whether or not they've had a particular thing called a nerve spare, other things which we would pick up on preoperative imaging, such as the stage of the disease, their past medical history, how big the patient is, previous surgery, all features of which we would know going into the operation. So then once we had that information, I used Python to create a multiple linear regression model in SK, using the sklearn package. And then following on from our machine learning topics, we then tried to optimize a model. So I used forward feature selection, which I thought was quite nice. And then from all the features that we fed in, we ended up with the age, surgeon, trainee, presence of a trainee, stage of the disease, and the prostate size, all of which were features which we used in the most optimized model. Of interest, for the assumption for multiple linear regression model is that none of the features are correlated with each other. However, I found that the surgeon who was the fastest also did the most of a particular type of operation, which adds time. So what that meant was when you added in a feature which I know takes longer, it messed up the model, and ultimately the model didn't include that feature, which I thought was interesting. I think a tree-based model going forward would take that into account. So that's certainly something to look at in the future. So then once we had the model, we thought it would be fun to create a natural language processing model, which would pick out those relevant features that I mentioned. So age, surgeon, trainee, presence, stage of the disease, and prostate size. So instead of having to, manually plug those in, could we create a natural language processing model which would automatically read a patient's letter, which had already been dictated, take those variables and plug it into a model, and then hopefully give a decent prediction. So we did that. Now, we were warned multiple times about the difficulty in training a natural language processing model from scratch. So what I ended up doing was, which you could probably see here, is I ended up using entity rulers. So it's not, it's a bit of a messy way of doing it, but instead of having to go through and label, hundreds of letters with the relevant features and to train the model with vast computational expense, with these entity rulers, you can essentially specify what you are looking for in the text. Which is a bit of a cheat, but I found it worked really well. And for these very specific things that we're after, there's not much nuance. It's very, very clear. It's either T2A or T2B. And if it's very, very clear and very explicit what those things are in the letter, I found it was actually quite easy to pick it up with those entity rulers. I think going forwards, it would be nice to train a model going forwards. So then we've created this app. So the QR code should work, but I can also share it with you. So feel free to use the QR code and tell me it doesn't work. And here's just an animation of it. But essentially, we came up with this very simple app, and you can feed in a patient letter here. And then once you've done that, you calculate the operative time, and it should work. Well, it does, because this is a video, so it has to work. So this just gives you the predicted operative time. So this was 102 minutes, and it pulls out useful bits of information which the surgeon would want. I have tried to account for missing data in there. So if there is no age or it can't find the surgeon, it would take the overall group average, if that makes sense, in order to try and account for that. So how good is the actual model? Well, it's got an R squared of 0.7. So compared to the mean model, it was able to explain 70% of the variability in the operative time. I think another way of putting that is to say, to make a prediction, the most simple way of making a prediction on how long an operation would take is to take the whole cohort and just take the average, the mean operative time. But by adding in these features, which I've already mentioned, so the age, the surgeon, the presence of a trainee, we're then able to explain 70% of the differences of the variability in the time taken. And that's apparently is rather significant, which is nice. And then here is a table just of the actual features here and their p-values and confidence intervals. Again, I think there's some interesting things in that some of the variables or the features we used didn't reach statistical significance, but they were still included in the model because they added they improved the model's performance, which I think is interesting but quite difficult to explain to clinicians. So what, just to summarize, we were able to use our own local data to better predict operative times. And we would hope that we could then automate the process and actually use known information to better schedule patients. I think this is something which can be used for not just this particular type of operation, but lots of different types of operations. I've already mentioned we only had 125 or 6 complete patients, but we are trying to collect more data. It'd be great to get over 500 or so. I'm going to try and use a tree-based model going forward just to see if we can get an even better R squared. And then the power of natural language processing model is it's amazing to automate this. It'd be great to actually train a proper model.